Good evening, guys. I have your bonus show, and it's discussion D: how to recognize and fight clogged arteries, signs, prevention, and treatment strategies. Okay, so here we go. Refers to a health focused guide aimed at helping people identify early warning signs of arterial blockages, understand its cause, and explore ways to prevent or treat it based on the surrounding page content and supporting videos. Here's a breakdown of what this topic covers. What are clogged arteries? Clogged arteries, also known as arterial sclerosis, occur when plaque, a mix of fat, cholesterol, and other substances, builds up in the artery walls, restricting blood flow. This can lead to serious conditions like give me 1 second. Coronary artery disease, or CAD, heart attacks, or strokes. Recognizing the signs. Early detection is key. Symptoms may be subtle or silent, especially in early stages. These videos offer crucial insights. Mayo Clinic Minute: signs of coronary artery disease. How to, okay. Then there's Dr. Regis Fernandez explains common signs like chest pain, angina, shortness of breath, and fatigue, especially during exertion. Number 3, silent signs of clogged arteries you should never ignore. Those are videos I just read for you guys. So those are on MSN Health. If anybody wants to check those out, feel free. Okay. Highlights overlooked symptoms such as jaw pain, leg cramps, and erectile dysfunction, which may signal poor circulation. Signs of potential heart blockages. How to identify symptoms. Offers a quick overview of how symptoms like throat tightness, dizziness can be red flags. Prevention strategies. Preventing clogged arteries involves lifestyle changes and proactive health management. Coronary heart disease, or CAD, signs, causes, and symptoms. Explores how high cholesterol, smoking, poor diet, and lack of exercise contribute to CAD and how to counteract them. Coronary heart disease, clogged arteries, and arterial sclerosis. Uses animation to show how risk factors like hypertension, smoking damage arteries over time. Reversing heart disease, Mayo Clinic radio spot. So you can click on this on the link on their website. Discusses national strategies and lifestyle interventions that help reverse arterial damage. Treatment options. If arteries are already clogged, treatment may include medication to lower cholesterol or blood pressure, lifestyle changes like diet, exercise, surgical interventions such as stents or bypass surgery. If the following videos provide deeper insights. Coronary artery disease symptoms, causes, and treatments. Offers a comprehensive overview of treatment options from medications to procedures. Blocked arteries, when to call for help. Cardiologist Dr. Knott explains when symptoms warrant immediate medical attention, why it matters. Understanding clogged arteries isn't just about heart health, it's about preventing lifestyle threatening events, life-threatening events, and improving quality of life. The surrounding content emphasizes early recognition, proactive prevention, and evidence-based treatment to empower individuals to take control of their cardiovascular health. If you'd like, I can help you co-design a culturally responsive toolkit or myth-busting resource around this topic, especially tailored for aging population or caregivers want to explore that next. Clogged arteries caused by plaque buildup in the vessel walls can have serious, even life-threatening consequences, depending on where the blockage occurs. Here's a structured breakdown of the major risks and outcomes. Okay, guys. Give me 1 second. Okay, cardiovascular consequences. Heart attack, myocardial infarction. When coronary arteries are blocked, oxygen-rich blood can't reach the heart muscle. This can cause chest pain, which is called angina. Okay. shortness of breath, and eventually heart tissue death. Heart failure, chronic narrowing, reduces the heart's ability to pump efficiently, leads to fatigue, fluid buildup, and shortness of breath. Aneurysms, irregular heartbeats, arrhythmias. Irregular heartbeat may result from clogged heart tissue or poor perfusion. Neurological consequences: stroke, ischemic stroke, a blocked in cerebral arteries cuts off blood to parts of the brain. Symptoms include slurred speech, facial drooping, and paralysis. Brain tissue can die within minutes, leading to permanent disability. Okay. Peripheral consequences: peripheral artery disease, or PAD, affects arteries in the legs and arms. Causes pain, numbness, and poor wound healing. In severe cases, may lead to gangrene or amputation. Electrolyte dysfunction: reduced blood flow to pelvic arteries can impair sexual function in men, often an early warning sign of systematic arteriosclerosis. Vision and organ damage: renal artery occlusion, blockage in eye arteries can cause sudden vision loss. Kidney damage: renal artery arteriosclerosis reduces kidney function and may lead to hypertension or kidney failure. Systematic risks: sudden death, complete blockage in major artery can cause fatal events without warning. Chronic inflammation and vascular aging: ongoing plaque buildup accelerates vascular stiffness and systematic inflammation, contributing to aging related decline. If you're thinking about how to translate this into community resource kit or resource or toolkit, give me 2 seconds, guys. Okay, especially for aging population or caregivers, I'd love I'd be thrilled to help co-design something culturally responsive and myth-busting. Want to sketch out a framework together. The Mediterranean diet isn't just a nutritional plan, it's a deeply rooted cultural lifestyle with wide ranging health benefits, especially relevant to aging populations, cognitive health, and chronic disease prevention. Here's a comprehensive breakdown. Core benefits of Mediterranean diet: cardiovascular protection, lowers LDL cholesterol, and improves HDL levels. Reduces risk of heart attack, stroke, and coronary artery disease associated with lower blood pressure and improved endothelial function. Cognitive health and dementia prevention linked to slower cognitive decline and reduced risk of Alzheimer's disease, especially in individuals with high genetic risks, APOE4 carriers. Supports brain health through anti-inflammatory and antioxidant-rich foods like olive oil, nuts, and leafy greens. Diabetes and metabolic syndrome. A 6-year trial showed a 31% reduction in type 2 diabetes risk when paired with moderate exercise, even without major weight loss. Improves insulin sensitivity and stabilizes blood sugar levels. Anti-inflammatory and longevity effects. Rich in polyphenols, omega-3s, and fiber, which reduces systematic inflammation associated with lower cancer risks, improved gut microbiota, and slower aging markers. What makes it unique? Feature Mediterranean diet, Western diet, fat source, extra virgin olive oil, unsaturated fat. Unsaturated is butter, processed oils. Saturated protein focus, fish, legumes, poultry, red and processed meats. Carbohydrates, quality whole grains, vegetables, refined grains, sugary snacks, sugar intake minimal, added sugars, high sugar consumption, meal philosophy, communal, mindful, seasonal, fast, processed, convenience driven. Okay, cultural and practical relevance. Adaptable across cultures, easily modified to fit African American, uh, Latinx, Asians, and rural dietary traditions. Sustainable and enjoyable, emphasizes flavor, variety, and shared meals, making it easier to maintain long term. Evidence based, supported by decades of research, including the landmark 7 countries study and recent trials like uh, Redeemed and Redeemed Plus. If you're thinking about adapting this into a culturally responsive framework, say for rural aging communities or caregiver toolkits, I'd love to help co-create a modular guide. We could include myth busting sections, e.g., is olive oil really better? Culturally tailored food swaps, and even life review prompts tied to food memories. Want to sketch that out together. The Mediterranean diet stands apart from any popular diets, not just what it includes, but how it's proceeded or practiced, sustained, and culturally embedded. Here's a comprehensive breakdown. Across key dimensions, drawing from the recent analysis and expert rankings. Mediterranean diet versus other popular diets. Okay, paleo, flexition, core philosophy, balanced, plant forward, culturally rooted, high fat, low carb, low sodium, heart focused, ancestral eating, no grains / dairy, mostly plant based, flexible, primarily fat source, olive oil, nuts, animal fats, oils, Mediterranean fats, animal fats, coconut oil, plant oils, nuts, carb approach, whole grains allowed, uh, severely restricted, whole grains. These are different diets, folks, that I'm trying to go over with you. Okay, encouraged limited whole grains allowed, protein sources, fish, legumes, poultry, meat, eggs, cheese, lean meats, legumes, meat, fish, eggs, plant proteins, occasional meat. Okay, I'm gonna, these are diets based on research. Okay, next page. Give me 1 second, guys. Evidence-based, exclusive, decades of research, mixed short-term results, strong clinical trials, emerging growing. Why Mediterranean stands out. Top ranked for 7 years in the U.S. News, World and Report. Best diets list. Proven to reduce risk of heart disease, stroke, Alzheimer's, and cancer. Encourages communal eating, seasonal foods, and cultural flexibility. Doesn't rely on restriction or elimination. Makes it more inclusive and sustainable. Practical implications for aging and cognitive health. Okay. For your work in aging and cognitive health, the Mediterranean diet offers neuroprotective benefits via omega-3s, polyphenols, and antioxidants. Culturally adaptable modules for rural and marginalized communities. A foundation for myth busting around fats, carbs, and age-related nutrition. If you're interested, we could co-design a comprehensive toolkit that maps these diets against aging outcomes, cultural fit, and caregiver feasibility. Want to sketch that out next. The Mediterranean diet has a powerful and well-documented impact on cognitive health, especially relevant to aging populations, dementia prevention, and even offsetting genetic risks. Here's a synthesis of the latest findings. Cognitive benefits of the Mediterranean diet. Slower cognitive decline. Longitudinal studies show that people who follow a Mediterranean-style diet experience slower memory loss, better executive function, and improved attention span over time. A randomized trial published in JAMA Internal Medicine found that older adults who consumed Mediterranean diets enriched with either olive oil or nuts had significantly better cognitive scores than those on low fat controlled diets. reduce risk of dementia and Alzheimer's. A 2025 study from Harvard, MIT, and Mass General Birmingham found that the diet lowers dementia risk, especially in people with high genetic susceptibility, e.g., APO4 carriers. Participants with 2 copies of APO4 gene who faced a 12-fold increased risk of Alzheimer's showed the greatest protective effect when adhering to the Mediterranean diet. Metabolic pathway modulation. The diet influences blood metabolism or metabolites linked to brain health, such as lipid profiles, inflammation markers, and oxidative stress indicators. These metabolic shifts may help preserve neural integrity and reduce amyloid plaque formation. Why it works. Mechanism: Mediterranean diet impact. Anti-inflammatory, rich in omega-3s, polyphenols, and antioxidants. Vascular protection, improves blood flow to the brain and heart health. Gut-brain axis, supports, enhances microbiome diversity, introducing reducing neurotoxins, oxidative stress reduction, neutralizes free radicals that damage brain cells, neuroplasticity, support nutrients like B vitamins and flavonoids, and repair so equity and adaptation potential for your work. This diet offers culturally adaptable modules for African American, rural, and aging communities, a foundation for myth busting around fats, carbs, and cognitive aging. Opportunities to co-design toolkits that integrate food, memories, and life review prompts, and caregiver-friendly meal planning. Would you like to sketch out a participatory framework or toolkit that translates these findings into community-based cognitive health interventions? We could build in evaluation matrix and culturally responsive adaptations. Okay, guys, so that is it for tonight. See you tomorrow for shows. For now, Gator Wellness. Take care, folks.